Well, a very good afternoon, everybody, and welcome to this Aging Well with Sickle Cell event. My name is Arne de Kreuk. I'm one of the hematology consultants at King's. Some may know me, some may not. We're very glad to have you here. And before I introduce you to John James, the CEO of the Sickle Cell Society, who will open the session, I need to tell you about a few important safety things, as one does these days. Without much further ado, John, may I welcome you to open the session? And thank you so much for coming.
It's my pleasure. My absolute pleasure. Good evening, everyone. Nice to see some familiar faces that I know well, and others that I haven't met before. So it's a pleasure to be here this evening. And what I wanted to say just to open today's event is really people with sickle cell are living longer, okay? And just some positive evidence-based data. People living with sickle cell in the UK are living longer in this country than other parts of Europe. So, and there's evidence to prove that. So that's good. Listen, look at me. I'm a man of a particular age. Don't guess what age, but I'm a man of a particular age, and I'm getting older. And obviously, with getting older, there's sports injuries, there's other issues. But I think for people living with sickle cell, things like necrosis of the hip, retinopathy, organ damage, those things are not things that relate to aging because they can come much earlier in one's life. And the reason that I'm mentioning that is that it's really important that there is research and work on aging with sickle cell. And the clinicians in the room here know that there isn't much data out there about people living longer with sickle cell. So that's why it's important for us, the Sickle Cell Society, working with King's Health Partners to do this piece of work. And I just want to take the opportunity to say thank you to King's Charity for funding it, because pieces of work like this are not always funded. So this is an important work. And you here today are really going to be playing an important part in shaping and informing and influencing that work. So the output of that work, if there are going to be new services or changes in pathways, it must, in our view, have the voice of the patient and families informing what that is going to be. It's really, really important, and I'm glad that I've been invited here to stress the importance of it, but also to stress the importance of your contribution in making sure that the research goes well, there are outputs from the research, and it all has your fingerprints on it in terms of what is going to be better for people who live older with sickle cell. So that's all I wanted to say, and I look forward to continuing working with the clinical colleagues here and running the focus groups and other pieces of work that we're going to do as part of the patient involvement exercise. So with that, I'm going to stop and hand to Sabana. Thank you.
Thank you, John. And a warm welcome to everybody today. My name is Subhana Chakraborty. I'm actually a pediatric hematologist, so you might almost feel, oh, what am I doing here in a conference that we're discussing, in a meeting that we're discussing aging sickle cell patients. So for that, we have Arne, who will give you the background and tell you a little bit more about the work that we are doing. Again, I want to echo what John's just said. So thank you very much for King's College Charity for supporting this work. I mean, it's it's fantastic that you've provided us with this funding so that we could do this very important work. I would like to just give you a little bit of introduction to who we are and what brought us here. And none of this would be possible if it hadn't been for King's Health Partners Hematology that supports King's Health Partners Sickle Cell Centre of Excellence. So I was just telling John before this event started, that Centre of Excellence might seem like quite a bombastic word, but that's what we want to achieve. We want to achieve excellence in the care for sickle cell. And I'm the clinical lead for this whole project, and hence I'm providing the introduction. And Arnie will follow this to explain to you what this project is about. So the Sickle Cell Centre of Excellence was established a few years ago, certainly before the pandemic, and it basically brings together or consolidates what we can provide for our patients in this region and perhaps even beyond. So what we already know, what we already provide is the clinical care. There is excellence in research that there has been, over decades, but we wanted to bring everything together so that there was a, cohesive support and understanding of how best we can enhance the work that we do already. So this is kind of, I don't know if it's very clear, but right in the middle is the patient. So that is basically the purpose of our existence, obviously. And actually, with the help of Marie, who is one of our core members of our team, we have set up a patient advisory group. And, with the patient advisory group, we are in business. Essentially, we are doing what we do. And in terms of the other aspects of the Sickle Cell Centre of Excellence, we have the research arm, we have the clinical services arm, and the education arm. So we are obviously still wanting and needing more research, more funding for research. So you all will be aware that funding for research in sickle cell is woefully under supported. And that's something that we want to work. And, John James has done fantastic work in improving awareness. Clinical services, there has been a sea change in the approach to improving sickle cell services, but there is so much more that we can do. And education, education is a fundamental thing that we all need to improve our awareness of the condition and provide care that our patients deserve. Everything comes together with mind and body. And that is fundamental to what King's Health Partners believe in and does. So that applies to Sickle Cell Centre of Excellence as well. And this is basically it. This is, as part of this work, we got together with the support of King's Health Partners Hematology team, put together this grant, and KCH charity kindly funded it. And to hear more about this project, I'll hand you over to my colleague, Dr. Dick Crook.
Well, thank you, and again, also with many thanks to the charity for making this project work. So my sort of 10 minutes are about aging not so well with sickle cell, and then hopefully that will sort of set the part of the background for what we're trying to achieve. So there is a lot available in the UK and on the NHS about living well, aging well, and tackling premature mortality. And this is just a screenshot of one of the NHS England web pages, and you can see that there is attention for long-term conditions. There is for sepsis, there is for stroke, you name it. And this is sort of, I won't read it through in detail, but basically the statement that the NHS, following government initiatives, etc., have put out. And it's the sort of last line of the first paragraph is very important. It states, starting with prevention, early identification of frailty, and supporting people appropriately on the basis of their needs through to the end of their life. There is, let's say, a document which is called the NHS England on long-term conditions, and that was published a few years ago. Basically, the gist of it is, I've skimmed through all these policies. There's a lot on long-term conditions, but I would almost say, surprise, surprise, the word sickle does not occur on any of the policies. And that's basically, I think, where we are going to step in. We want to make sure we have a similar-ish framework for people with sickle who are aging as well. But as John said, this is not something that we should work out in our offices and think, well, we know what's good for you. We really need input and see what matters to people who are aging. Because it could be very different from what we assume, or indeed from what Age UK have published for people of over the age of 70 without sickle. I wanted to show you a few slides just to sort of see how concerning it is to live with sickle and what basically people come across in terms of other conditions related to their condition that just make them more frail. I don't like using the word frail when describing people, but I think it's fair to say if you have any of these conditions that you can consider yourself frail. So we are running the natural history study in the UK, which some of you are undoubtedly part of, which is a very large prospective database where we collect as much data as possible on health parameters and also quality of life parameters. And this slide is an overview of the conditions that we've counted so far, split by age group. So when you look at for example, avascular necrosis, the one at the top, you can see that between the ages of 18 and 30, approximately 10% of people is affected. That number doubles between the ages of 30 and 50 and trebles after the age of 50. And when you look at the other conditions, you sort of see a similar pattern, perhaps with the exception of stroke. And I think we all know that unfortunately a lot of very young people with sickle cell children experience stroke at a very young age. But more or less all of the other conditions, there is a sort of very clear landmark below 30 and over 30. And that's a lot earlier than in people without sickle, because speaking for myself, colleagues and friends who don't have sickle, we start taking all our tablets after, let's say, the age of, well, 50 perhaps, but not after the age of 30. So there's a sharp increase in organ damage after the age of 30. And what we can also see from the natural history study, and apologies, this is a slightly more difficult graph to interpret, is that the quality of life also goes down with age. So if you look at, so I just have to have a look at what's on my own screen here. For example, the top left, which is pain-related complications, if I can see it correctly. Apologies for me being slightly hesitant here. The line in the middle here means the average answer given by people with sickle cell in the UK. So if, let's say, someone scores 50 here, it means you're comparable to peers. So the overall group, as you can see in the King's College cohort, so this is for patients, adult patients registered to King's, is roughly around the 50% mark, as you expect. But then if you look at the bigger picture, you can see that the majority between 18 and 13 have a higher score. In other words, they feel better in terms of pain. And then it starts dropping significantly as people get older. It doesn't actually go below the line, but this indication here indicates that there are quite a few people with a very poor score here. And that is sort of a universal finding as well. So both in terms of organ damage as well in quality of life, we see a decline happening after 30-ish onwards. Something else, and this has not been researched in the UK, but that's something that we definitely want to include in this project. And is actually a particular concern, I think, is screening for other conditions not related to sickle cell, because we don't really do that systematically in our clinics. And certainly GPs don't know how to screen, for example, for diabetes. This is an American study, but we're aiming to put a similar-ish thing into the Aging Well study. When you look at this study, there were about 50% of the people that were sort of screened would qualify for screening for diabetes, but only 28% of those people were actually screened. So a large group of people was missed out. But even more worrying is that the wrong screening tools were used. So if you look at the people who were correctly, so people with sickle, who were correctly screened for diabetes, that was only 10% of the entire population, meaning that 90% of the people with sickle are not properly screened for diabetes and are thus at extra risk of organ damage. That is a very, very significant finding, and I'm very worried that we actually looking at similar things even in an area like London, where we've got quite a few people with sickle. So what do we want to do? So the project, first of all, we would like to sort of identify how frail, again, apologies for using that word, but it sort of describes what we're doing, our King's patients over the age of 35 years old are. We've had long discussions where to put the sort of benchmark. Are we going for 30? Are we going for 40? Are we going in the middle? Some of the studies look at adults, which is a bit too young in life, I think. The majority of these studies in elderly patients with sickle cell are sort of either 40 or 50 years old. So we decided basically to go somewhere in the middle. And I think we can justify that based on the graphs we show earlier, but obviously it may be a question that sort of comes back to us, but this is sort of what we've chosen to do. And then we subsequently want to identify how well our preventative healthcare screening system is performed in the community for people registered to King's. We would like subsequently, as John touched upon, try to identify the unmet needs to support people with sickle cell appropriately in order to, well, prevent early frailty and improve quality of life. I know that's a very ambitious statement, but I think from the questionnaires and things that we're going to do, we will probably find out where certain areas of interest are that is not highlighted enough at the moment. And then finally, yes, indeed, we would like to publish these results and provide input for healthcare improvement projects and also for the development of new clinical guidelines. So we really need your input, as John said. We need to collect data, robust data, and we need to analyze that properly. So this project is not just about listening, but it is very much about research and quality improvement in the future as well. Thank you. So it's my pleasure to introduce the next speaker. And the next speaker is Elvis Adua, who is a hematologist, but also someone with sickle cell. And Elvis will give us an overview from the patient's perspective, which will hopefully give you a lot of food for thought for the discussion later on. Thank you.
Hi, I'm Elvis, and patient with sickle cell. And thanks, Arnie, for that talk. Seems I've got a lot to look forward to in life. Also, I've put no science in here because I've left that all to you. So thanks. But when I thought about growing old and staying healthy, I had to look at a few sources, mostly, NHS England and the Office for National Statistics, and just look to see who grows old, but also who grows old and stays healthy. And you'll be unsurprised to find that you're more likely to grow old and stay healthy if you're living in a more affluent area and earn quite a lot of money. And also a higher level of education correlates with a much healthier life in older age. And actually, so for every extra year you spend in education after 13, on average, you live 2 years longer. And that's a pretty big age gap or mortality gap, especially for people that end up going to university and studying beyond that. What hasn't been studied as well is exactly why, but I think we know some of the reasons. We know that if you're more educated and you live in a more affluent area, you've probably got a little bit less pollution around you, and that's something that we can't necessarily control. You're probably likely to have a much healthier diet. You're probably likely to do a little bit more exercise. So there are certain things that we can control and certain things that we can't control. Oh, I will project my voice. So when we talk about when I'm thinking about myself, I often think about what can I do to protect myself in the future. And some things I can control. I can, myself and anyone that I might be responsible for, take my annual vaccines, for example. I can take the regular medication that I'm prescribed, and some that I'm not prescribed. For example, we're all advised to take vitamin D. I'll take a multivitamin. There are lots of things we can do to help ourselves, but these are certainly things that we can completely within our control. And I know there's been a lot discussed about vaccines and medicines, but we should all be doing things that are recommended by our doctors. Other things that I do, well, I mean, I don't do it as well as this guy looks to be doing it, but I do play some sport when I can. We know that bone health is one of the major factors in growing old and staying fairly healthy, and muscle strength as well. And that's something that we kind of tend to all tell our elderly patients to stay as strong as possible. But not everyone can get up and run around and play sports, and sometimes just taking a long walk around and going on a hike is good enough. But some exercise, that's another thing that's completely within our control. So these are the things that I've thought about that are controllable. A few other things there. Eating a healthy diet. Now, if you stick into Google eating a healthy diet, you'll always get the type of meal that's on the left. What's on the right is what I much prefer. But we don't have to stick to one or the other. We can just add a few more things from the picture on the left to what we eat, and just make little changes. Not no one's asking us to completely change our diet overnight and give up the things that we might like doing. And so I've mostly stuck to positive things here. Some of the negative things, also smoking, drinking, we know that will contribute to a shorter lifespan and things we probably shouldn't do. So when I thought about aging healthily, I thought about the controllables, and these things that I've mentioned. There are some things that we can't control, and I guess this is where John James comes in, and we can't control the amount that's spent on the NHS until we get a few of us in this room, up in this building. But we'll leave that to the executives and people. We can't control these things, but some things that are kind of in the grey area of what we might be able to control are policies. Now, a quick Google search, you will find fantastic policies on the acute management of sickle cell. And that's some great work that has been done over the years. You'll also find, I found this policy on managing sickle cell disease during pregnancy. And the reason why it's important for us, I mean, this website couldn't even be bothered to find patients that look like they have sickle cell. But that's where we come in. It's important that we do create new policies, because we don't have one, for example, in managing sickle cell above the age of 40 or 35. And it's quite important. What we all can do is give our opinion, tell our clinicians what's important to us, sign up to these studies. In terms of, a lot of them are observational. Collecting data is very, very important for anyone that's in research to be able to collate the information and maybe come up with new answers as to how we can improve the quality and quantity of life of patients with sickle cell, which is our goal here. So this last one is in something that we can't definitely control, but we can definitely help and give our time and efforts towards this. And that's it, really. I just wanted to say thank you for showing up, and hopefully we can have this type of policy in the years and decades to come.
Hello, everybody. Sorry about that. Can you hear me at the back? Just let me know. I have a loud voice, but I probably need a mic. So thank you so much for coming. It's we've been looking and working on this project and preparing for it for a long time now. So this is a real celebration that we're here together to talk about this. And I think you probably heard loud and clear tonight that they're involving you the patients, the carers, the families in this project. We can't do it without you. So I want to talk a little bit, and I think you've got some kind of handouts and stuff about how we want to do that and why it's important. I mean, it is important, isn't it? But why is it important? And how we're going to do it and how you can be involved. Please, please be part of what we're doing. Like I said, I'm going to keep saying this. We can't do this without you. Now, I think we all realise involving patients is crucial and vital. I've worked in patient public involvement in the NHS for a long time. I'm absolutely passionate about it. I came into this job not doing it, but I can't not do it. And I think this project is an absolutely excellent opportunity to do something quite creative around this. I mean, how do we understand the experience of people over the age of 35 living with sickle cell? Well, we ask you. We ask you what it is like for you and ask you what it is you want. And we can work together. And I'm not being completely unrealistic here, but I think we can do something pretty creative. But using, as Arnie said, looking at research as well, so we can kind of get the word out, we can share what we're doing, and we can look at, actually, this is the first stage of our project, I think, because after we've done this project, we need to think about what we're going to do with this. And I know Sabana's been talking to colleagues about potentially commissioning models of care around this, so we're pretty excited around it. So this is an NHS England definition around why involving patients. You probably hear a lot, oh, it's really important, and you probably given so many surveys to ask for what your feedback is. But actually, one thing I think is quite interesting in this sort of quote, people who have the poorest health. Now, in my experience of working in the NHS, I don't think we're always very good at asking people with very serious health problems what matters to them and how we can work with them. I think we kind of shy away from that a bit. And, you know, sickle cell, as you all know, is a very serious health problem. But also we need to understand about how improving access to services, how working together can reduce health inequalities. So how people can feel more confident about accessing health services, more confident about saying what it is, what they want, and what's important to them. And actually, like I said, being a bit more creative with this. And I guess the quote about taxpayers' money, okay, fair enough, you know, we're not kind of looking at sort of spreadsheets around this, but actually, how can we get an understanding of what matters to people without asking people? And I think we've all said this today. So I just want to give you a bit of a flavour, because Sabana spoke earlier about the Sickle Cell Centre of Excellence. We are thinking of a new title, I think, around that. Maybe it's something we can ask you at a later date, but something that maybe is a bit more relatable, I would say, but particularly within King's Health Partners as well. So, and I think, Sabana, you said pre-COVID, sorry if I got the date wrong, but when we did launch the Sickle Cell Centre of Excellence, we did some focus groups. Some of you might have been involved in that. We spoke to you about it. We got your feedback around what mattered to you, looking at really more joined up care around sickle cell. We've done some really excellent work around filming, getting some videos of people, getting people to share their experiences with us of accessing acute care. So I mean, kind of coming to A&E, coming through the hospital, maybe not through a planned route, talking about what it is like for you to come to A&E, what it is like for you to experience a crisis, being in severe pain in A&E, what you would like from doctors, what you would like to experience in the environment. And we've actually used those films to create training material that we use across Kings and Guy's for people working in those areas. So for me, and I think I've spoken to someone earlier, understanding what it is like for people, hearing from the people, and thank you, Elvis, for sharing what it is like living with sickle cell. There's nothing more powerful. You know, I could sit here and tell you what it's like. Well, so what, you know, kind of, there is nothing more powerful for hearing it from the people. And in these films, we have parents talking, children talking, you know, and they are a very powerful tool for change that we believe that, you know, through training and awareness raising. And I think part of this project, a big part of this project for the Aging Well is raising the awareness, because I think we've said it's not something that people maybe be aware of, the GPs, people like that, the general public. So through this, we want to raise awareness of what it is like over the age of 35 to be living with sickle cell disorder. So we have a cross-trust sickle meeting. We like long titles here, don't we? We had one this morning, actually, and it's a meeting where staff across Kings and Guy's come together to talk about the recommendations from the APPG report. Now, we have 2 patient reps on that meeting. They are, and I'm not just that they're a vital part of that meeting. They're a vital part of the conversation. And we got an email from one of the reps today to say how important that meeting is for her, how important it is that she has a voice, that she can contribute. And the chief nurse at Guy's chairs it, and she's very careful to make sure that people have a space, the patient reps, to talk and contribute to the meeting. And I think that works very well. It's not that often the meeting, but there's something about we continue the relationship with them outside the meeting. I have attended and support groups around, Kings and Guys both have support groups. You probably go to them for sickle cell. I've attended the Guys one to talk about the work that I'm talking about today, and also to talk about things like the recommendations from the APPG report, because I don't think we're that good at actually sharing what we're doing. So to find ways to share it in a way that people feel comfortable and kind of in explaining in languages that's helpful for people, I think is really, really important. We've done a really interesting piece of work with Genomics England about understanding the barriers to engaging in research and solutions for people living with sickle cell disorder. And that's completely led and involved with patients. We bring people together, the groups happen without us. And it's the Genomics England patient voice, so they're kind of national, and it's the Sickle Cell Centre of Excellence patient carer group. And we're going to come together in March to have a celebration, but also really challenge about what are the next steps around this. I do really think it's important through this work that we can use those recommendations to inform research going forward within the Sickle Cell Centre of Excellence. I'm pretty ambitious. I think there's lots of opportunity here. And I've spoken about the kind of patient carer reference group. Just to bring this to life a little bit, I'll just put some of the stuff we're doing to kind of show we are doing it. Someone might recognise themselves in that picture over there, I'm not saying, but so we've done some great stuff. We went to an event, the bottom left picture, talking to researchers about the importance of sickle cell, how to engage with communities that they might not normally engage with, and how it's important to do that. The top left, that's a still from the training film I mentioned as well. And that QR code, you might want to scan it, takes you to our YouTube channel, and it has all the films in full that we've done. And we put posters in A&E, in outpatients, to encourage staff and patients and the public to look at the films and learn from them. So anyway, how do you want to involve people, in this project? So you're here today, amazing. Thank you for sharing. I think when you signed up, you shared what matters to you around people over the age of 35. We've got lots of fantastic feedback already. We're collating that and theming it. There's going to be an opportunity to do that a bit more later on. Something that we're really keen on is having patient representatives on our steering committee. So a steering committee is what will drive the project. We will meet probably every month at the beginning. We've got some really interesting people who are involved, people who are in this room. I'm not going to name you all because people don't want me to do that. But we need to have patients on the committee to help drive the focus, to help be part of what we're doing. And what is really important, I think, is to have patients involved from the beginning to the end, not just a little bit, to be part of the journey through the whole lifetime of the project. John has mentioned we're very grateful to the Sickle Cell Society, going to help us do some focus groups. So as the project develops, as we understand the areas of focus from you, to do a bit of more of a deep dive, but also we'll do other focus groups as and when they evolve and arrive, because it's really important not to just say, oh, it's just this, this and this. One focus group might bring another focus, if you know what I mean. Surveys, if that works, we're really keen to hear from you. How do you want to be engaged with? Maybe you don't want another survey. I've said there's lots of surveys anyway, but share your story. Please share with us what it's like for you, because like I said, it's so powerful to hear from people about their own experiences, as long as you feel comfortable doing it, to help inform others and help inspire others as well. And we're sort of creating a social media kind of platform and space. If you can follow us, and I think you've put on the little things that it's there. So, and we're really keen to know other organisations, community organisations and groups to link with as well. So what next? So if you're interested in joining the steering group, please, submit a kind of an expression of interest, we call it. It's not a job application, it's just to show us you're interested. Please join our mailing list. We're going to do newsletters. We're going to keep you updated about the project. And please follow us on our social media and help connect us with other groups that might be interested in our work as well. So I think after this, it's really important we understand how this launch was for you, if you know what I mean. We might do more of this. Did it work for you? Would something be better? It's really important that these kind of events work for you. And if you think this is something that we could do again, we'll do it. And there's also, I think some people have said they want to be filmed. So if that's great, you don't have to be. And I know, Becky, you're going to be taking some photos maybe as well. So it's a bit of a celebration. So that's literally what next. So what we're going to look at now, I don't know if anyone's used a Menti before. So if you have your phones, and I hope you feel comfortable doing this, if you don't, please let us know, because actually you can give feedback in lots of different ways. You've got our email address, so if it's not tonight and you think of something, oh, I sure wish I said that, just get in contact. Oh, I love that everyone's got their phones. So if you could scan the QR code, and there's on your little bits of paper, there's a code to put in. So it's just a way of gathering feedback around things. Gathering feedback. There's some things we're going to take you through, and all this information you're giving us, we collate and we're going to use to help form the focus of the project. This project is just beginning. We're right at the beginning of it, because of course we are, because we're talking to you about it.
Okay, yeah, just wanted to add very, very briefly, because I think it's important. So we are very keen to have people enrolled, but we ultimately want to relate all feedback to individuals' health situation.
Yeah.
So that means that if you do, and we're incredibly grateful, because for everybody who does it, embark on the project, we will also ask you for permission to relate it to your personal factors, like your age, for example, your hemoglobin, any health parameters. And because we're doing that, it's different from a normal survey that you would just send around and analyze. We really want to relate it to the demographics of the people who participate. So that gives it a slightly more formal character, meaning that we will ask you for your formal consent to participate in the project as well. Obviously, that doesn't include what you do today, because this is just an online survey where we do like polls, but the real power of this project is to relate it to who you are, and what your health and your mental health is like. I just wanted to throw that in, and then I'll leave it to you again. Thank you.
Me to say that.
I did.
So carried away, but yeah, that is a really important. Thank you, Arnie, for showing that, because the kind of hearing from you, hearing your experiences, but the power of actually using alongside the medical data to really affect change, I think is probably something that I would say, but I think it's very unique about this project. So thanks for that. I just really want to give you a very whistle-stop tour, but really constantly reiterating how important your involvement is and how you can be involved. But again, lots of opportunity maybe for other things, to be, again, creative, do things a bit differently. I hope so. I think we're going to have some time now to do some questions and answers, because I'm sure you probably have questions or things you want to raise. So can I invite the speakers to the front, please?
The question.
So basically, thank you, Sickle, for your question. If I may sort of give a more general answer, I think this is probably typically a question that lots of people have in terms of what is good for my diet, what should I take, what should I not take. And obviously there are individual cases. Some people will have iron overload because they may have had blood transfusions in the past. There's lots of transfusions. Then maybe it's people who have a lack of time. Sorry. Should I restart again?
Can I just remind everyone, don't ask specific medical questions. We just want you to ask questions based on the project and the presentations that you've seen today.
Yeah. So basically, but one of the things that may come forward from this project is that lots of people have dietary questions or questions about supplements or want to have more research into supplements. So that is typically something that could come forward, which is why we want you all on the various focus groups and panels.
Thank you, Arnie. Any other questions?
Yeah, okay, we've got that.
I mean, I'll start, and then I think maybe John can comment, because we are working with the Sickle Cell Society to do the focus groups. But we thought about this a lot at the beginning, and I think, you know, obviously sharing your personal experience, maybe reliving some of the worst things you've ever been through. So I've met a couple of times with an organisation who specialise in trauma, trauma-led facilitation. I know that sounds a bit kind of, but actually they're very experienced in working with people and very careful at how they work with people to talk about things that might potentially have a huge impact on them. So to be very mindful of facilitating in a way that's appropriate, and actually not just coming and saying, oh, come on, tell us about your, you know, I'm not trivializing it, but I know exactly what you're talking about. So that's one of the things we're doing and thinking about. But also we spoke about this when we spoke to the Sickle Cell Society, and if you want to add anything.
Yeah, so I agree. It's a very good question. And I think Marie's covered it in the sense that people who are participating in this piece of work will need to have support within the focus groups, but also outside of the focus groups. So it's not just the focus groups. We being the Sickle Cell Society and King's Health Park and colleagues in this, to make sure that that support is there. You know, the important principle is anybody who's participating should feel comfortable in sharing their voice about the issues, but knowing that they can be supported should that become uncomfortable at any point, whether that's during a focus group, after a focus group, or any point during the process. So I hope that gives some reassurance. And as Marie has kindly said, it's something that we thought about at the outset. So yeah, but it's a really good point. Thank you.
Yep, we'll take one more questions from the room, and then those online, if you could write your questions in, and then we can try and address them as well.
Yeah, thank you. I think your question, and thank you for that, is actually exactly what this project is about. We are sort of hoping that there will be some surprises. In other words, that the things that we generally think about may not necessarily be aligned with what really matters to patients. And you already saw it a little bit in the survey that we did. we have very much been trained as in making sure your blood pressure is within target, that your hemoglobin is good enough, that you take your hydroxycarbamide in a particular dose, because that's sort of what matters to us. We have our targets and our drivers and etc. But for example, if I may give an example of Age UK, which I found very enlightening, is that one of the main complaints or areas where people felt uncertain about was computer literacy. Because people could just not cope with online prescriptions and all kinds of other things. And it was a complete surprise to me to read that that was what matters to patients. And I'm sort of hoping that by sitting here together, we can sort of look at making sure we do it correctly and not just focus on what is medically important. I mean, there are definitely a few things in the project that we are very keen to explore further. I mean, the diabetes being one of them, and I strongly believe in as Alpha, sorry, I was looking there for you, said, like making sure you exercise, you have sort of gentle muscle training and things like that, because I think that is very important, but I may be wrong. So what we don't want to do is put a whole program in place for exercise only to hear the people say, yeah, but that's not actually what we want, because it's yet another appointment. So that's, I think, why we want to give this back to you.
Can we have questions from online? So if you're online, you can put your questions in the Q&A section.
That'd be quiet. So it's a very good question. So the way diabetes screening happens, the easiest way to screen diabetes is to check how much sugar, how much glucose or sugar, glucose essentially, is attached to somebody's hemoglobin. So if your body has seen a lot of glucose, for the long time, the glucose will stick to the hemoglobin molecule, the hemoglobin A molecule specifically, hemoglobin A, which is the adult hemoglobin. And the way it will stick to any kind of hemoglobin, but the adult hemoglobin is what is measured. So everybody who hasn't got sickle cell, they will, if they have a screening test for diabetes, they will have their HbA1c measured, meaning how much glucose is attached to your hemoglobin A. Now, if you have no hemoglobin A, how do you measure your diabetes? So people don't know this. You'd be surprised how few people actually realize that you cannot do HbA1c in somebody who does not have HbA. So that's where we are coming from. So I don't know if that makes it. The other thing that happens, of course, is that the red blood cells need to be exposed to the glucose for a certain period of time. And that's usually how long red cells survive in the normal, in the body. And for people who haven't got sickle cell, the red cells will survive for about 4 months. So what we are reading is up to 4 months of exposure to glucose for every red cell. Now, we know that sickle cell patients survive, the red cells survive much shorter period of time. So they will actually not be exposed to glucose that much at all, because they are getting turned over very quickly. So that's another reason why actually measuring HbA1c is a complete waste of time in measuring, in assessing or screening for a sickle cell patient with diabetes or pre-diabetes for that matter. So we need to increase this awareness, and we need to find the easiest way in which this diabetes screening can be done.
Thank you. Got one more.
May I add a tiny bit to that, because this is one of my favorite topics. And that's just, thank you, Subhana, because that is a message that we're trying to get across all the time. But related to that, unfortunately, is that people who do have diabetes are also not monitored properly, because the whole healthcare system in primary healthcare relies on this hemoglobin A1c. So the GPs will say, look, everything is fine. Your hemoglobin A1c is perfectly well below the limits, whereas patients may actually be severely at risk of diabetes-related damage. And the sad truth is that people with sickle and diabetes, that's possibly the worst combination, if not controlled well. And when you look at endpoints like time to dialysis. People who have sickle and diabetes spiral down to dialysis very, very quickly, much more quickly than you would expect either having sickle alone or having diabetes alone. So it's a very, very important thing to improve health and well-being.
I think I've got one more question in the room.
Oh, thank you so much for that. I'll say something. Sorry, Arnie's very keen. I think we all want to say something. I just very quickly say that a project like this, any project like this, the ambition would be that there is a peer support network that's naturally being built by being involved in it, that coming to meetings, coming to focus groups or engaging online, you're kind of naturally meeting other people who are in the position that you're in, when sometimes can feel a very lonely place to be. But the thing you raise, and I think this is what, the question was raised earlier, that the things and what you've said is something, we're hearing, and maybe my colleagues have heard many times before, but it's something about hearing things like that and actually understanding that and the impact of loneliness on people as well. So you make an excellent point, and it's the further we look into this, the further we understand, but also, yeah, kind of how we can create a community of people and also understand, because I think there's a lot of great stuff happening in the community that people probably aren't aware of, that we can signpost to or understand and be able to share with people. But thank you for that. John, did you?
Thank you very much, Marie. That's a great question. And the only thing I wanted to add to what Marie said is why this project is important, because Elvis, I think, mentioned about policies. So whilst Marie is right, but part of the outputs of this work might be things that we need to put in place to support people who need that extra support. I don't know what the models of that might be, but that could be one of the outputs, that we create new policies and get those agreed and funded, hopefully, to do exactly that. That's why it's important that we hear these things as part of this process. Thank you.
And just to add that we have invited the Integrated Care Board representatives. So Integrated Care Board is now the people who hold the purse strings for the money that's spent locally in for healthcare, and we would very much like them to be part of our steering group right from the outset, so they understand what people want, so that then they can go and decide what they want to fund. And often these commissioning bodies, if you like, they're looking for projects to commission. They want a very well-informed, suitable project that they can fund, and we are essentially telling them, this is what we've understand patients' needs are, and they may then be able to support us with commissioning the right pathway. So that is kind of one of the aims of this project, is to provide commissioning packages, if you like, for them to fund. So I'm hoping that will be an output for this project.
Thank you. We're overrunning, so I'm going to take one more question in the room. But before I do that, I just want to remind you that you can actually email questions. So if you think of something once you've left here, you can email the AWWSC, so Aging Well with Sickle Cell, at kcl.ac.uk. Okay, you can email your questions, so it's not going to be lost. So just one last question, and then to Arnie.
Thank you for your question. Yes, absolutely. But we just haven't basically written the guidelines, I think, correctly, because part of this project is that we're going to see how big the problem is in our catchment area. And I'm sure that will translate to the rest of the UK. So the data I showed you is American data. So the healthcare system obviously is slightly differently there. junior doctors who are sort of ready to go and analyze the data for our cohorts as part of this project. But I'm afraid it's not going to be very different. And that will be a big call, because once we have that data, we can, highlight the problem and go back to the commission, see what needs to be changed, because the current system in primary healthcare is just simply not set up to do it correctly. Because it's a very clear pathway what needs to be done. And what we expect to see is that people with with sickle are screened for diabetes, but just the wrong way, and then are dismissed as not having diabetes, whereas they may have it. But obviously that requires a change of policy and change of guidelines, and that's where we see our job. And that's maybe one aspect of the project. We say, okay, we'll take the lead in that because we have to do it, even if none of you say that's important, we'll do it anyway. But does that answer the question? Okay, right. I can never do this in a natural way. Thank you very much for attending. So first of all, it was great to see you here, great to hear the questions, and we'll have some refreshments upstairs. And what I really hope is that everybody will be able to attend, and that we can have sort of more informal chat and sort of get some more ideas. But we've already had heard some great examples of things that are important to the project. So thank you very much for that. I also need to remind you about the feedback form completion. So that's all on your desk.
And Arnie, can I just say thank you to all the staff who have come. It's very, very important that we have a whole, not just hematologists, certainly not a pediatric hematologist. So thank you everyone for coming. So really, really grateful for everybody's involvement in this project.